The signs scattered around Lewisham Hospital in South London are a reminder of another virus, not COVID, but HIV, very much still with us, and in too many cases going undetected.
I almost broke down this roof. Honestly, I was screaming because it was the least I expected. I thought life was ending.
You always think of drug users and other people getting HIV, not me. I thought, how, when, why?
Both these women had come into the emergency department for other conditions, but as part of a trial they were told they would be tested for HIV unless they opted out. They spoke to us anonymously and are voiced by actors. The stigma around this virus is still very much alive.
I'd been to the GP because I was worried about my health, so I came for an emergency test. I was not thinking I could be HIV. I wasn't living with a man at the time.
I'd come to the A&E with stomachache, a really bad stomachache, and the doctors asked me if I wanted to have the test. I was in a bad state with my health anyway, and then I was told I had HIV.
In the 2 years the trial has been running at 3 hospitals and in GP surgeries in South London, nearly 200 people have been picked up. Either they didn't know they were infected or they had been lost to HIV services.
The pilot took place in Lambeth, where I am now, and Southwark and Lewisham because they have some of the highest HIV rates in the UK. It's estimated that there could be as many as 1,000 people in these 3 boroughs who do not know they're positive. So tomorrow, the Independent HIV Commission will call for a national rollout of this testing wherever blood is taken in GP surgeries or hospitals so they can find those underlying infections.
This pilot has not been funded by the NHS, despite the huge savings to the health service when HIV is picked up early. Instead, the Elton John Aids Foundation has developed a social impact bond, a partnership formed with healthcare providers, councils and other investors.
It's been a huge success. It's been a very easy project to implement, actually. It doesn't require many resources, doesn't require much cost apart from the blood tests, which are actually really cheap.
What is the importance of catching the HIV early on?
By diagnosing them early, you prevent them becoming unwell. The second issue is that if you diagnose someone earlier, they're less likely to pass it on to someone else. So in the vast majority of cases, even somebody just knowing that they have HIV will mean that they change their sexual behaviour.
Once the infection is picked up in the emergency department, patients are referred to the hospital's HIV clinic with specialist staff.
The majority of patients are from a heterosexual background. The majority are from a black ethnic background. But we are finding as well surprising numbers of patients sort of over the age of 50, 60, and our first diagnosis was in a patient over the age of 80.
This patient is in her early 60s and she says she has no idea how she caught the virus.
Do you wish you didn't know?
No, not at all, because if I didn't, maybe I would be worse. Like the doctors were saying, you could die without treatment. Since I started my treatment, everything is changing. I am getting better.
But how did your partner take it?
Better than I expected. We're still together. His main concern was the issue I'd come in for in the first place. It took me 3 days, though, to stew because I didn't know how I'd react if I was him.
It's estimated that just over 100,000 people are living with the virus in the UK and around 6,600 are undiagnosed. There is a very clear message that detected and treated early, HIV is not a death sentence.
Well, earlier David Furnish spoke to Victoria MacDonald about why they set up the pilot study.
We found ourselves after a decade of austerity that investment funds within the NHS were frozen. And we knew that undetected HIV was basically a ticking time bomb, that if we didn't find it sooner rather than later, if unidentified HIV goes on for people to develop chronic long-term AIDS, which costs the healthcare system a lot more money in the long run. So we identified the opportunity and the need for a private investment solution to help fund results in a public sphere, simply put.
But tomorrow the Independent HIV Commission will say that this needs to be rolled out nationally and rolled out through this type of funding mechanism, or should the NHS pick up the bill?
We invested £1.5 million in finding undetected HIV, which saved the NHS £55 million in costs. So the numbers speak for themselves. And while we have people in emergency wards having blood drawn anyway, we're just saying, let's put in opt-out HIV testing, because the costs of doing that far outweigh actually pay for the savings that we make by them not developing or carrying HIV and passing it on to someone else.
Had you worried, or do you worry, that COVID-19 had taken all the spotlight away from the other epidemic of HIV?
So COVID-19 represented a significant challenge for us, but Elton and I had a telephone call with Dr. Fauci in America last week, and we talked about the fact that there's going to be this tremendous drive into the health system for people getting vaccinated against COVID. Now, there's another opportunity to get opt-out HIV testing done at the same time. If people are coming into the service to get a vaccine, let's see if we can pick up some undetected HIV. Getting an HIV test now can be incredibly simple. It can be a fingerprint test, it can be a cheek swab, or if they're having a blood draw, we can just tick it on the list of things that are looked after. So we're actually thinking longer term or medium term as people step into vaccination. Maybe this is an opportunity to pick up even more undetected HIV.
So has Dr. Fauci said he would back this testing?
Absolutely. I mean, I think one of the things we're learning with COVID, and it's public health 101 really, is you have to test to know where the problem is in order to deal with it effectively. And I know Dr. Fauci is a great advocate of ramping up more COVID testing in America. And certainly more HIV testing is going to pick up undetected HIV, which saves the healthcare system money in the long run and stops new infections dead in their tracks.
The pilot study in the 3 London boroughs revealed around about 200 people who'd either didn't know they had HIV or who had got lost to the system somehow. Were you surprised by those numbers? Had you expected more or less?
They were slightly higher than we expected. The whole nature of undetected HIV is that you don't know because it's undetected. It came in slightly higher. The most amazing thing was that the cost saving per patient, based on when we got them. Some people we got as they'd just been exposed to HIV. Some people had been carrying it for a long time. The cost per patient was about £250,000 saved. Those are the numbers that speak to the commission report, which is coming out tomorrow. Let's get early testing. Let's get opt-out testing. And let's save these people from getting sick and ill in the long run by not knowing they're having HIV and developing AIDS, which puts a greater strain on the system.